Greenwell Medical Center in Sydney stood as a beacon of medical excellence, a world-class hospital celebrated for its cutting-edge surgical teams and glowing reputation. But sometimes, behind polished glass doors and polished resumes, an institution's real character is tested not in the operating room, but in the quiet hallways where unnoticed staff work their hardest. Welcome to Family Crime Chronicles, your ultimate destination for chilling true crime stories. We uncover the darkest corners of real-life mysteries, twisted affairs. Please comment, and subscribe now for new episode of True Crime Stories. Enter Jace Turner, a newly hired male nurse, experienced professional, quiet, a man who wanted nothing more than to do his job right. What he didn't know was that his presence, his very identity, would rattle a system that had gotten too comfortable with its own blind spots. And what happened next would reshape Greenwell's culture from the inside out. When Jace Turner arrived at Greenwell Medical Center, he wasn't there to make waves. A seasoned trauma nurse from a busy regional hospital, he was no stranger to pressure. Tall, reserved, and methodical, Jace was the kind of nurse who knew exactly how to bring calm to chaos. But none of that seemed to matter here. Greenwell's cardiac recovery ward was prestigious, no doubt. It was also overwhelmingly white, upper class, and unaccustomed to change. And as the only male nurse on the floor, and one of the few Indigenous staff members in the entire hospital, Jace stood out, uncomfortably so. From the moment he introduced himself to the team, he felt it. The subtle hesitations and handshakes, the extra scrutiny during rounds, the thin smiles that didn't reach the eyes. No one said anything overt, but the message was clear. He wasn't one of them. His first encounter with Dr. Fiona Chambers, one of the hospital's most respected cardiothoracic surgeons, set the tone. "Male nurse," she remarked, her tone clipped. "Well, just don't get in the way." Jace offered a professional nod. "I'll do what's best for the patient, doctor." He was used to being underestimated. What he wasn't used to was what came next. Just a week into his new position, Jace was assigned to Lillian Marks, a well-dressed, elderly woman recovering from triple bypass surgery. Her charts were complex, but Jace had dealt with worse. He moved with careful precision, checking vitals, adjusting monitors, and gently changing her dressing. Then, without warning, Dr. Chambers swept into the room. "Did no one tell you how delicate this patient is?" she barked. "This isn't a playground for amateurs." Jace straightened. "I followed every post-op protocol to the letter." Lillian turned her head, watching silently. Dr. Chambers scoffed, loud enough to echo. "Let's hope you don't kill her with kindness." The silence in the room was deafening. Jace felt the burn of embarrassment crawl up his neck. But he didn't flinch. He adjusted the monitor and continued his task. He didn't know Lillian had noticed everything. Most staff assumed Lillian Marks was a typical private patient, wealthy, well-connected, and probably someone's donor relative. But none of them knew the truth. Lillian Marks was the founder and chairwoman of the Southern Cross Healthcare Foundation, a multi-million-dollar organization currently reviewing hospitals for a long-term grant focused on inclusive, patient-centered care. She had deliberately left her title off her forms. She wanted to experience Greenwell as an ordinary patient, to see how the hospital really functioned behind the scenes. And what she saw stunned her. She had watched the subtle hierarchy, the disrespect toward support staff, and the blatant dismissal of a nurse who showed nothing but competence and care. It wasn't just the surgeon's outburst. It was the culture that tolerated it. The next morning, Jace arrived for his shift to find a surprising note clipped to his schedule. "Patient Lillian Marks has requested you as her exclusive nurse today." He hesitated. Exclusive patient requests were rare, especially for someone still considered new. As he stepped into the room, Lillian greeted him with a kind smile. "Do you know who I am, Mr. Turner?" Jace shook his head. "Just a patient I'm lucky to help." She smiled again. "I'm Lillian Marks." I fund hospitals. And I've been watching not just how you care for me, but how you've been treated. Jace blinked. I just try to do my job. And you do it with grace. More than I can say for some of the senior staff. Lillian paused and said, I intend to address this, and I want your permission to use this experience to initiate change. Jace, ever humble, nodded. He didn't realize just how powerful her words would become. That Monday, the hospital boardroom was full. No one expected the emergency meeting. Dr. Fiona Chambers sat near the head of the table, unaware of what was coming. Lillian Marks stood before the board and introduced herself. I am the chairwoman of the Southern Cross Healthcare Foundation. I have spent the last 7 days at this hospital under the guise of a recovering patient, and what I experienced revealed disturbing flaws. The room froze. I witnessed systemic disrespect toward staff, particularly those from diverse backgrounds. I witnessed a nurse publicly belittled by a senior surgeon in front of patient me. She presented written observations and video footage quietly recorded by a visitor. It showed Dr. Chambers' tone, words, and demeanor. Lillian didn't name names for vengeance. She did it for accountability. Dr. Chambers went pale. The board launched a formal investigation. In the weeks that followed, Greenwell Medical Center began to shift. Lillian's foundation offered a substantial grant, but it came with strings. The immediate creation of a diversity and inclusion board, mandatory equity training for all senior staff, regular review of promotion and hiring policies, and one more condition: the appointment of Jace Turner as head of nursing development and inclusion. Jace didn't expect it. He didn't ask for it, but he accepted with quiet humility and a determination to make the hospital better for those who would come after him. Dr. Chambers took a leave of absence pending review. Some supported her. Others began to question long-standing norms. Jace's story made quiet waves, not in headlines, but in how people talk to each other, in who got a seat at the table, in who got the benefit of the doubt. Jace Turner didn't come to Greenwell to be a hero. He came to help people heal. But in standing still, in doing his job with kindness and integrity, he held up a mirror to a broken system. And sometimes, it's not the loudest voice that changes everything. Sometimes it's a quiet one, the one that simply refuses to disappear. Subscribe for more real-life stories of silent strength and justice that speaks louder than words.